Hey everyone, and welcome to all you future nurses out there. Today, we are going to break down a skill you'll be doing all the time, converting a continuous IV infusion to a peripheral lock. Let's nail this down. So let's start with the basics. What are we even talking about here? A peripheral IV lock, or what you'll probably hear called a saline lock, is basically just putting a cap on a peripheral IV line. You do this when your patient doesn't need that continuous drip anymore, but you want to keep that IV access ready to go for meds or in case of an emergency. It's all about keeping the line available without the constant fluids. And that brings up a really important question. When are you actually going to do this? Well, the provider will write a prescription for it once the patient is stable, well hydrated, and just doesn't need those continuous fluids anymore. Your job is to make that switch happen and to do it safely. Okay, before we even get our gloves on, we have to talk about prep and safety. Seriously, this first part sets the stage for everything that follows, and getting it right is absolutely crucial for a good outcome. Now, this slide, you're going to want to pay attention because this is huge for your NCLEX exam. Delegation is a massive topic. As the RN, you can delegate this to an LPN, but only if they've shown they're competent in the skill. But, and this is a big but, you can never delegate this skill to assistive personnel like a nursing assistant. And always remember, even when you delegate, you, the RN, are still the one responsible for assessing the patient first. All right, next step, let's get our gear together. You're going to need some non-sterile gloves, antiseptic wipes to clean that port, a pre-filled normal saline syringe to flush the line, and a bit of tape to lock it all down. Trust me, having everything you need right there at the bedside, it makes the whole process smoother and way safer. Okay, supplies are gathered and we've got safety on the brain. Let's get into the procedure itself. We're going to walk through this step by step. Phase 1 is all about your patient. And this isn't just about ticking boxes on a checklist, It's about building trust. Start by checking the chart for the prescription and any allergies. Provide some privacy, introduce yourself, and wash your hands. Then, identify your patient using 2 identifiers. You know the drill, name and date of birth. And then ask them directly about allergies. Finally, just explain what you're going to do. It really helps reduce their anxiety. All right, now for the hands-on stuff. First, you're going to assess that IV site. Take a good look and feel around for any redness, swelling, or pain. If it all looks good, go ahead and stop the infusion pump and clamp the tubing. Then, you'll disconnect the old tubing and get ready for the most important cleaning step of all. And listen up, because this right here is probably the single most important thing you need to know. When you scrub that IV port, you are doing so much more than just cleaning it. This one action is your best defense against a catheter-associated bloodstream infection, or a CLA-BSI. These are really serious, but they're also preventable. It all comes down to scrubbing that hub like you mean it, and then, this is key, letting it air dry. And now for the final technical bit, you're going to flush the line with your sealing syringe. Here's the pro tip. Maintain positive pressure, meaning keep pushing on that plunger as you clamp the line. It's a neat little trick that stops blood from backing up into the catheter, which is what keeps the line patent, or open, for the next time it's needed. A little bit of tape to secure it, and you're golden. So you've locked the IV, but you're not done yet, not even close. What you do next, the follow-through and knowing how to troubleshoot, that's what really makes you a great nurse. Think of these as the final wrap-up, and they are totally non-negotiable. Get rid of your used supplies in the right bins, take off your gloves, and perform hand hygiene one more time. And before you walk out of that room, make sure the call light is right where they can reach it and the bed is in its lowest position. It's all about leaving your patient safe and comfortable. But what if things don't look right? What if during that first assessment, the IV site just gives you a bad feeling? You absolutely have to be prepared for this scenario. This slide is basically your playbook for when things go wrong. If you see any redness, pain, swelling, leaking, if you can't flush it easily, or if you can see the catheter peeking out, the answer is always the same. Stop. Just stop. Don't try to force it. Your next move is to remove the IV and let the provider know what's going on. And that brings us to the final piece of the puzzle, the one golden rule you are going to hear for your entire career. If you didn't document it, it didn't happen. Good documentation is everything. So what do you need to charge? Well, the date and time you stopped the infusion, the fact that you flushed the line, what the site looked like, any teaching you did, and how your patient handled it. And of course, if anything unexpected happened, you have to document that and who you notified. It creates a clear story for the whole team. So if your brain is full and you can only remember two things from this whole explainer, let it be these two words: asepsis and patency. Asepsis means using a clean technique, scrubbing that hub to prevent infection. And patency means keeping the line open and working, using that positive pressure flush technique. Asepsis and patency. Got it? Look, getting skills like this down cold is what's going to make you feel confident out on the floor and help you absolutely crush the NCLEX. For more deep dive nursing explainers just like this, do us a favor and hit that like button, share it with your study group, and subscribe to our channel. And hey, to give you an extra edge, we've put links to our summarized NCLEX revision books down in the description below. They're designed to help you study smarter. Now we want to hear from you. What tricky nursing skills should we break down in our next explainer? Let us know in the comments.